Have you ever looked into the mirror and felt healthy? No fever, no pain, no clear sign of anything wrong, yet deep down, something wasn't quite right. Maybe your energy wasn't the same. You felt a little more tired than usual, a bit more breathless on the stairs, more irritable without reason, or forgetful of things you used to remember so easily. These small changes are easy to overlook. They don't scream for attention. They creep in quietly, slowly, and subtly, and they are often written off as just aging. But what if they aren't? What if these tiny shifts are early whispers from your body trying to warn you of something bigger? Many illnesses that affect older adults don't show clear signs in their early stages. They're called silent illnesses because they progress quietly, sometimes for years, until the damage is done. And by the time symptoms become obvious, it may already be too late for a simple fix. These diseases rob seniors of vitality, independence, and, all too often, they live simply because they weren't noticed early enough. But knowledge is power, and today, we're going to talk about these silent threats, so you can recognize them, understand them, and act before they take root. One of the most common silent illnesses in older adults is high blood pressure, also known as hypertension. It's often called the silent killer for a reason. You can feel perfectly fine, while this invisible force puts strain on your arteries, your heart, and your brain. It increases the risk of heart attacks, strokes, and kidney failure. According to the World Health Organization, more than 1 billion people around the world live with hypertension, and many don't even know it. For seniors, it's especially dangerous because the arteries naturally stiffen with age, making them more vulnerable. Routine checks, even at home with a basic monitor, can literally save your life. Another quiet invader is osteoporosis, a condition where bones become fragile and weak over time. You won't feel your bones thinning, you won't feel your spine compressing, but one minor fall, one accidental twist, and a fracture can change your entire life. For many seniors, especially women after menopause, osteoporosis advances silently, until it leads to broken hips, collapsed vertebrae, and a permanent loss of mobility. The scariest part is, some never walk again after such injuries. A bone density test takes minutes, but it can prevent a lifetime of pain and limitation. Let's talk about type 2 diabetes, a condition often marked by no symptoms in its early stages. It develops slowly, sometimes over a decade. Fatigue, frequent urination, increased thirst, these signs can be so mild they go unnoticed. Yet untreated diabetes quietly damages the eyes, kidneys, nerves, and heart. In fact, many seniors only discover they have diabetes after they develop complications like blurred vision, numb feet, or serious infections. Annual blood sugar checks are essential. But beyond testing, understanding the risk factors like weight gain, diet, and physical inactivity can help keep this silent threat away. Then there's chronic kidney disease, which often gives no warning signs until the kidneys are functioning at dangerously low levels. Your kidneys filter waste and balance your body's fluids, but when they begin to fail, you might not feel it until toxins start to build up in your blood. You may notice swollen feet, itchy skin, or trouble concentrating, but only after significant damage has occurred. And sadly, many seniors learn of kidney disease when dialysis becomes the only option. Blood and urine tests, along with monitoring blood pressure and blood sugar, are key to catching it early. One of the most emotionally devastating silent illnesses is cognitive decline, particularly Alzheimer's disease and other forms of dementia. At first, it may feel like you're just forgetting where you left your keys or why you walked into a room. You might misplace your wallet, forget a familiar name, or repeat a question unknowingly. These signs are often dismissed or hidden out of embarrassment. But Alzheimer's is not just forgetfulness, it's a progressive brain disease that, once advanced, robs a person of their memories, their ability to communicate, and eventually their independence. Early diagnosis may not cure it, but it opens doors for treatment, support, and planning. Another concern that slips under the radar is hearing loss. It doesn't come all at once. You may not notice that you're turning the volume up louder than others or asking people to repeat themselves. Over time, hearing loss can lead to social isolation, depression, and even cognitive decline. Studies from Johns Hopkins University have found a strong link between untreated hearing loss and faster rates of mental decline. Hearing tests are simple and painless, yet many seniors go years without them. Lastly, depression is one of the most silently endured illnesses among the elderly. Unlike sadness, which is temporary, depression is a medical condition that affects your energy, your sleep, your appetite, and your will to live. Many seniors feel they must tough it out, or believe that feeling low is just part of getting older, but it isn't. Emotional pain is just as real as physical pain, and it deserves attention and care. Depression doesn't always look like crying or despair. It often shows up as numbness, irritability, fatigue, or a loss of interest in things once loved. The right treatment, therapy, community, medication can bring color back to life. Each of these conditions is more common with age, but none are inevitable. Prevention is possible, early detection is powerful, and awareness is the first step. Every senior deserves the chance to live, not just longer, but better. By paying attention to the quiet signs, by listening to the body's subtle messages, and by staying proactive with health checkups, we can give ourselves that chance. You are not powerless. You are not fragile. You are wise, experienced, and capable of protecting your health one informed choice at a time. Let no illness steal your peace simply because it came silently. There's something particularly unsettling about the illnesses that don't knock before entering. They arrive quietly, almost politely, without fever or visible pain. Yet they settle deep within the body, growing stronger in silence. For seniors, whose bodies are already going through countless changes, these illnesses are especially dangerous because they don't shout. They are often ignored. And when they are finally noticed, it's not a whisper anymore, it's a storm. One such illness is atrial fibrillation, or AFib, a condition where the heart beats in an irregular or chaotic rhythm. Most seniors don't feel it happening. There's no dramatic chest pain or collapse. Instead, it might feel like a flutter in the chest, a racing pulse, a bit of fatigue. Nothing to raise alarm, but AFib increases the risk of stroke by 5 times. That's because the irregular heartbeat can allow blood to pool and clot in the heart. And if one of those clots travels to the brain, the damage can be swift and permanent. A simple pulse check, ECG, or heart monitor test can catch this invisible danger before it strikes. But too many people assume it's just part of getting older, and that silence becomes costly. Then there's glaucoma, leading cause of irreversible blindness. It steals vision slowly, beginning at the edges and creeping inward. The central vision stays clear for a long time, so many seniors have no idea they're losing sight until it's too late. It's only during a routine eye exam that the pressure inside the eye is detected, and by then the damage may already be underway. Glaucoma doesn't hurt. It doesn't blur vision overnight, but it can take away one of the most precious senses if left undetected. Regular eye checks can mean the difference between independence and total visual loss. One of the more surprising silent conditions is vitamin B12 deficiency. It may seem like something minor, but the symptoms, fatigue, memory issues, weakness, numbness in the hands and feet, can mimic more serious diseases like dementia or multiple sclerosis. B12 is essential for nerve health, red blood cell production, and energy metabolism. Many seniors are at risk due to reduced stomach acid, certain medications, or diet, and because the symptoms are vague and spread out over time, it often goes unrecognized. A simple blood test can reveal the truth, and with early treatment, whether through diet changes or supplements, seniors can regain their energy, mental clarity, and physical strength. Another illness that hides in plain sight is sleep apnea. Most people associate it with snoring, but it's much more than that. In sleep apnea, the airway collapses repeatedly during the night, briefly stopping breathing. The brain wakes up over and over, though the person might not remember it. This constant interruption disrupts deep restorative sleep and strains the heart. Over time, it raises the risk of high blood pressure, heart disease, stroke, and diabetes. Seniors often feel tired during the day or fall asleep unintentionally, but they don't always connect it to disrupted sleep. A sleep study can diagnose the condition, and treatments like CPAP therapy can drastically improve not only sleep but also overall health. Then we have anemia, an often overlooked condition in older adults. It occurs when the body doesn't have enough healthy red blood cells to carry oxygen to tissues. Mild anemia might just feel like fatigue or weakness, but it can progress to shortness of breath, pale skin, heart palpitations, and even chest pain left untreated. It stresses the heart and limits mobility. In seniors, it can also contribute to mental fog and an increased risk of falls. Causes of anemia range from nutritional deficiencies to chronic diseases, and proper diagnosis through blood tests can point toward the right treatment. Another condition that hides behind normalcy is urinary tract infection, or UTI. While in younger people, UTIs usually cause burning or urgency, in seniors, the symptoms are often very different. Confusion, irritability, falls, and sudden changes in behavior may be the only signs. These infections can go unnoticed for days, sometimes even weeks, and they can spread to the kidneys or bloodstream, causing sepsis, a life-threatening condition, especially in seniors who are already frail or living alone. Recognizing the signs of a UTI can be life-saving. A lesser-known but serious concern in aging individuals is thyroid dysfunction, particularly hypothyroidism. The thyroid is a small gland in the neck that controls metabolism. When it slows down, everything else does too. Energy drops, the skin becomes dry, the memory dulls, and the body gains weight despite a poor appetite. Seniors may assume this is just part of aging, but it might not be. A sluggish thyroid can lead to heart problems, depression, and cognitive decline if not treated. Fortunately, a simple blood test can reveal the condition, and medications can restore balance and energy. Let's not forget about silent gastrointestinal bleeding, especially from ulcers or colon issues. Seniors may not see visible blood, but inside, slow bleeding over time can lead to anemia, fatigue, and weakness. It's only when the symptoms become severe that doctors begin to investigate. This is one reason why routine colonoscopies and checkups are recommended in older age. They can detect polyps, bleeding, or early signs of cancer before they become serious. We also need to talk about silent cancers like pancreatic, ovarian, or kidney cancer. These often show no signs in their early stages and are discovered only when they've already spread. Seniors may lose weight unintentionally, feel vague abdominal discomfort, or experience a loss of appetite, signs that can easily be attributed to something else. But catching cancer early is often the difference between life and death. Being vigilant, having regular screenings, and never ignoring strange, persistent changes in the body can give people a fighting chance. Silent illnesses don't make a scene. They don't announce themselves, but they are there, in the background, quietly changing lives. For seniors, listening to your body, even when it's whispering, is a skill that must be honored and sharpened. The goal is not to fear every change, but to respect every sign. Being proactive isn't just smart, it's empowering, because you deserve to age with clarity, with dignity, and with the strength to live on your own terms. Sometimes the greatest threats to our health aren't the ones we see coming. They don't strike with sudden pain or loud warnings. They slip in quietly, dressing themselves in everyday tiredness, common forgetfulness, or subtle changes we mistake as just getting old. For seniors, these kinds of illnesses, slow-moving and dangerous, are some of the most life-altering and even life-threatening conditions they will ever face. The scariest part, many people don't know they're affected until damage has already been done. Take peripheral artery disease, or PAD, for instance. It's a condition where the arteries that carry blood to your legs and arms become narrowed or blocked. At first, it might just feel like a heaviness in your legs, or a bit of pain when you walk too far. But that ache is your muscles crying out for oxygen they're not getting. Left untreated, PAD can lead to critical limb damage, and in the worst cases, even amputation. Seniors often mistake it for arthritis or just weak legs, but the underlying problem is much more serious. A simple check of the pulses in your legs, or a test called an ankle brachial index, can detect it early, offering a chance to restore circulation and protect mobility. Then there's macular degeneration, another silent thief, this time targeting vision. Unlike sudden vision loss, this condition starts slowly, affecting the center of your sight. You might notice straight lines looking wavy or colors seeming faded, but it's easy to dismiss. Many seniors continue reading, driving, or managing daily life without realizing that their sight is deteriorating. This slow blindness can eventually steal the ability to see faces, read books, or live independently. With early detection through eye exams and the right vitamins or treatments, the progression can be slowed dramatically. Silent illnesses don't just affect the body, they wear down the spirit. For many older adults, chronic fatigue isn't always about age. Sometimes, it's a sign of congestive heart failure beginning to develop. The heart starts to struggle to pump blood effectively, and the body begins to hold on to fluid. But in the beginning, the signs can be so mild: a little shortness of breath while gardening, or swelling in your ankles that comes and goes. These aren't always seen as red flags, but they should be. Congestive heart failure is manageable, especially when caught early. Medications, diet changes, and light exercise can make a tremendous difference. But too often, seniors only find out about it after a hospital visit that could have been prevented. Another invisible danger is colorectal cancer, which is one of the most common cancers in older adults. It doesn't always cause pain. It may not even cause visible blood in the stool, but it grows quietly, affecting the bowels and eventually spreading to other parts of the body. The good news is that it's highly preventable through regular screening. A colonoscopy may not be anyone's favorite procedure, but it can detect and remove precancerous polyps before they become life-threatening. And yet, many seniors avoid it out of fear or discomfort, not realizing that prevention is far easier than treatment. Mental health conditions, too, often sit silently in the background of a senior's life. Anxiety, depression, and even mild cognitive decline don't always manifest the way they do in younger people. You might not see panic attacks or tears. Instead, it can look like irritability, sleep disturbances, withdrawing from social activities, or even a change in appetite. The world sometimes assumes older people are just grumpy or set in their ways, when in fact they are silently struggling with real, treatable conditions. Left unchecked, these can spiral into deep emotional and cognitive deterioration. But with gentle support, understanding, and sometimes medication or counseling, a brighter, more peaceful daily life is absolutely possible. There's also the very real danger of malnutrition, which hides behind a full pantry and a modest lifestyle. Many seniors live alone, cook less, and eat less sometimes because they're not hungry, sometimes because chewing is difficult, and sometimes because food just doesn't feel enjoyable anymore. But poor nutrition leads to weakened immune function, slower healing, fatigue, and increased risk of infection. The body needs protein, fiber, healthy fats, and a rainbow of vitamins to function well, especially in older age. A balanced diet, perhaps supplemented by smoothies, easy-to-prepare meals, or even meal delivery services, can protect the body from the slow decay of nutrient deficiency. One of the most misunderstood and unspoken silent illnesses is emotional neglect. It's not a disease in the traditional sense, but it can be just as destructive. Seniors who feel ignored, unappreciated, or unloved begin to shrink emotionally. They speak less, engage less, and begin to believe that their time, their thoughts, and their presence no longer matter. This emotional silence has been linked to shorter lifespans, higher rates of depression, and a deeper sense of loneliness than physical isolation ever could create. That's why real, heartfelt connection isn't a luxury, it's a necessity. These silent illnesses demand attention not because they make noise, but precisely because they don't. They require us to listen more closely, observe more carefully, and trust that small changes in how we feel may be telling a larger story. Whether it's your legs, your vision, your mood, or your breath, nothing should be dismissed without thought. If you found this message eye-opening or helpful, and if you believe in taking small steps toward a healthier, more informed life after 50, we gently invite you to subscribe to the SeniorsUpLife YouTube channel. Here, you'll find not just videos, but a community, a place where your voice, your questions, and your health truly matter. Every week we share guidance from doctors, real stories from seniors like you, and tips to help you stay strong, joyful, and aware of the hidden signs your body might be trying to show you. Your health journey matters, and we are honored to be part of it.